But what we do know is that this will change the world completely. Everybody was knowing that this could be a possibility. Many countries prepared, others didn't. After SARS, there was the coronavirus, the MERS coronavirus, and then this one occurred. We weren't expecting this, but we knew that something might occur someday, and in fact, the World Health Organization's called this Disease X, which nobody knew about and which we're now experiencing. And so countries like South Korea, where there was a major MERS corona outbreak, in countries like Singapore and then Hong Kong and Taiwan, all were well prepared, and they've been able to control this outbreak very well, as has China. The UK and Europe in general, and North America in general, did not take the warnings as did some of the Asian countries, and they don't have the stocks of ventilators and the beds that they need to really isolate patients who have this infection. As we can see in Italy, the health system is unable to accommodate those who require hospitalization for this infection, and there's a very high mortality rate, a very high death rate. And at the same time, they're not able to accommodate the normal patients without COVID infection. And again, they're seeing an increase in mortality among these people. So hospitals are the key to this. And if they're not prepared, it costs economies both in death and in economic output. Well, we don't yet know how this disease will play out. That's the real problem. What we know is that when a disease emerges from the animal kingdom into humans, it can cause an outbreak and then disappear, or it causes an outbreak and then becomes endemic in populations and finds humans as a permanent resident. When we see the economic disruption and the numbers of people who are at risk of infection and at risk of death, we know that in the future we can't go on in the same way. A little bit of investment before these outbreaks would have prevented the major investments that are having to be made now.